In the time it takes to fly from one continent to another, a new virus can do the same. An outbreak that starts in a remote village can become a crisis in a major city in less than a day. In our hyper-connected world, the threat of a pandemic is always there. But working against that threat, behind the scenes, is a global network of scientists and data analysts. They are the unseen sentinels, our first line of defense. They practice a discipline called epidemiological intelligence, and this is the story of how they use data to predict and, whenever possible, prevent the next global catastrophe. Epidemiological intelligence is the art and science of collecting, analyzing, and interpreting health data to take action. It's a continuous cycle. Seek, verify, assess, and act. The goal is simple but vital. Detect threats early enough to stop a small outbreak from becoming a global nightmare. The COVID-19 pandemic was a brutal lesson in our vulnerability, but it also spurred these agencies into action, accelerating the development of new tools to ensure we are never caught so unprepared again. So who are these architects of global health security? At the center is the World Health Organization, or WHO. As the UN's coordinating authority on health, its job is to build a healthier future for everyone. In the wake of COVID, the WHO established the Hub for Pandemic and Epidemic Intelligence in Berlin. Think of it as a global innovation center, bringing together experts to build the next generation of data-driven tools for pandemic prevention. One of their most powerful tools is a platform called EIOS, which stands for Epidemic Intelligence from Open Sources. EIOS is a web-based system that scans enormous amounts of public information, news reports, social media posts, government websites, in real time. Using a blend of artificial intelligence and human expertise, it sifts through all that noise to find the faint, early signals of a potential health threat. More than 70 countries are now part of this network, creating a unified global listening post. The WHO also launched the International Pathogen Surveillance Network, which focuses on sharing and analyzing the genetic data of viruses and bacteria. By understanding a pathogen's genetic blueprint, scientists can track its spread, predict its severity, and develop targeted vaccines and treatments. Then there are the national and regional powerhouses. In the United States, you have the Centers for Disease Control and Prevention, the CDC. Their mission is to protect Americans from health threats, both at home and abroad. A cornerstone of the CDC is its Epidemic Intelligence Service, or EIS. These are the world-famous disease detectives. For over 70 years, these trained epidemiologists have been on the front lines, from helping eradicate smallpox to fighting recent measles outbreaks. Through its field epidemiology training program, the CDC has trained over 11,000 of these disease detectives in more than 70 countries, building a global workforce ready to contain outbreaks at their source. Across the Atlantic, the European Center for Disease Prevention and Control, or ECDC, acts as Europe's shield against infectious diseases. The ECDC runs a platform called EpiPulse, an online portal where European public health authorities can share and discuss disease data. It combines traditional reports with cutting-edge data from genome sequencing to create a complete picture of any potential threat. But no single organization can do it alone. That's why the WHO coordinates GOARN, the Global Outbreak Alert and Response Network. Established in 2000, GOARN is a partnership of over 300 institutions, labs, and NGOs. When a country's own resources are overwhelmed by an outbreak, they can call on GOARN, which can deploy international teams of experts in epidemiology, diagnostics, and clinical management. Since its creation, GOARN has responded to over 180 missions, tackling everything from SARS and H1N1 to Ebola and COVID-19. So what's actually in the Disease Detectives Toolkit? How do they find these threats? The methods range from old-school, shoe-leather epidemiology to cutting-edge digital analysis. The bedrock is what's called indicator-based surveillance. This is the systematic collection of data from hospitals and labs. Doctors report cases of specific, predefined diseases. It's reliable and essential for tracking long-term trends, but it can be slow to catch something new or unexpected. To find those novel threats, they use event-based surveillance, or EBS. Instead of waiting for a confirmed diagnosis, EBS focuses on unusual health events. This could be a cluster of people getting sick, unexplained deaths in animals, or even just rumors of illness spreading through a community. The information is often unstructured, coming from news reports, public hotlines, or social media. Here's a powerful example. In May 2024, in Freetown, Sierra Leone, a hospital worker used a special hotline to report a cluster of food poisoning cases. Because of recent training in event-based surveillance, a rapid response team was on site within 12 hours. They contained the outbreak completely, with 0 fatalities. In recent months, using information from social media and community WhatsApp groups, Sierra Leone's Ministry of Health has also used EBS to detect and respond to outbreaks of cholera, anthrax, and Lassa fever. A related method is syndromic surveillance. This focuses on pre-diagnostic data, in other words, symptoms. Before anyone knows what virus is spreading, people start showing up at the emergency room with coughs and fevers. They start buying more cold and flu medicine. School absenteeism might go up. By tracking these aggregated behaviors, systems can spot an early warning sign. New York City's syndromic surveillance system, for example, monitors data from ER visits. During its first year, it successfully flagged periods of peak influenza and norovirus activity, proving its value as an early warning tool. Now, let's talk about the digital revolution. This is where epidemiological intelligence gets a major upgrade. The emerging field of digital epidemiology leverages data from our online lives, social media, search engine queries, and health apps to track disease. The theory is that our online behavior reflects our health concerns. Studies have found that analyzing Twitter and Facebook posts for mentions of flu-like symptoms can detect outbreaks an average of 12 days earlier than traditional reporting. Similarly, Google search volumes for terms like coronavirus or pneumonia were found to peak 5 to 10 days before confirmed cases were officially reported. While early attempts like Google Flu Trends had some issues, modern approaches now integrate this digital data with traditional surveillance to create highly accurate forecasts of disease spread. But perhaps the most revolutionary tool is genomic surveillance. The ability to rapidly sequence the entire genetic code of a pathogen has completely changed the game. It allows scientists to study a virus at the molecular level, giving them incredible insight. During the COVID-19 pandemic, genomic sequencing was how we tracked the emergence and spread of variants like Alpha, Delta, and Omicron. Scientists could see, almost in real time, how the virus was changing. Was it becoming more transmissible? Was it evading our immune systems? This information was critical for updating public health guidance and vaccines. Genomic surveillance is also like a high-tech version of contact tracing. By comparing the genetic sequences of a virus from different people, investigators can reconstruct transmission chains with incredible precision. They can build a genetic family tree for the pathogen, figuring out exactly who infected whom and where an outbreak started. This was used to devastating effect to understand the spread of the 2014 Ebola outbreak in West Africa. Of course, all this intelligence is useless if it doesn't lead to action. The ultimate goal is to trigger a swift, effective response. The story of the Sierra Leone food poisoning outbreak is a perfect example of how early detection leads to rapid containment. The data also allows officials to target their interventions. By identifying high-risk areas or populations, they can allocate limited resources more effectively. For example, genomic data can pinpoint a cluster of drug-resistant bacteria in a hospital, allowing for targeted infection control measures to stop it from spreading. But what happens when the system fails? The 2014 to 2016 Ebola outbreak in West Africa is a tragic case study. It has been described as a